The commonest injuries that happens along with knee is the ligament injuries. The reason is the ligaments are the supportive structure for the knee joint. If you look at the structure of the knee on itself, it is totally dependent on the ligaments, menisci, cartilage and the muscles that supports it. Many times due to weight bearing, constant athletic activity involvement and due to some other reasons as well, these structures are more prone to develop injury. And among all the structures, anterior cruciate ligament, also called as ACL, is a structure which is much more prone to develop injury, especially tear. And this is the reason for young adults as well as athletes to go for surgical rehabilitation. Anterior cruciate ligament tear and injury is something that we are going to talk in today's video. So make sure you stay tuned with me till the end. Friends, I am physiotherapist Meghana and this is Health Q channel, the health awareness channel where our mission is to motivate you to look at the brighter side of the health. We come up with the videos every Monday, Wednesday and Friday on different health topics. So make sure to subscribe to our channel and press that bell icon so that you can get notified every single time we upload a new video. Anterior cruciate ligament is a ligament that supports the knee joint. This particular structure lies inside the knee joint and joins the two major bones, that is the thigh bone, also called as the femur bone, and the tibia bone, also called as the shin bone of the leg. These two bones are attached to each other with the help of anterior cruciate ligament. No doubt there are other ligaments as well who are involved in attaching these two bones, but anterior cruciate ligament has a major role involvement. The basic function of this particular ligament is to maintain the joint stability and at the same time absorb the shock and friction that comes while doing weight bearing activities. Stretch or tear of this ligament is something which is called as anterior cruciate ligament injury. Whenever a person makes a sudden movement, sudden twist, sudden turn, sudden fall while jumping, running, walking and even sometimes descending the stair, that time person develops this kind of injury. The common symptoms associated with anterior cruciate ligament injury is pain, swelling, instability of the knee joint, trouble or else difficulty in walking and bending of the knee, especially while moving down the stairs or descending the stairs. This kind of instability is a typical sign of anterior cruciate ligament injury. If this injury is mild, the patient might not even experience too much of pain and too much of swelling, but there would be a constant feeling of instability in the knee joint. If you who are someone who has got knee related injury and have these symptoms, make sure to see your doctor as soon as possible. Now, what to expect when you go to a doctor? Now, the ideal person to go to when you are having any kind of knee injury like this is an orthopedic surgeon. What does orthopedic surgeon do? Orthopedic surgeon will take a detailed history of how you fell down, what kind of injury happened, what was the mechanism of this injury. Based on that history, he will also perform certain physical diagnostic test, which is also called a special test, along with other physical examination like palpation of the area, seeing the movement of the area, etc. Apart from this, he might suggest certain diagnostic tests like X-ray, MRI scan, arthroscopy, ultrasound in order to determine the level and extent of damage to the anterior cruciate ligament that has happened. These tests are also helpful in coming up with the exact diagnosis because there are other ligaments also that exist in the knee joint which could be damaged and can show little similar symptoms. Hence, it's very important to determine which particular ligament has been injured. Based on the level of injury, whether it is in tear or is in strain, treatment is decided. Treatment basically comprises of first, RICE regime. This is an acute care where RICE regime stands for rest, ice, compression and elevation, which means the limb that is injured requires certain level of rest, especially for around 7 days, followed by ice pack application, the joint which can be provided with the help of crepe bandage or else some kind of belts that are specially available to prevent movement around the knee joint. After compression, the second thing is elevation of the limb in order to prevent the swelling that is being developed around the knee joint. This is about the acute or else initial management. Further, the doctor may prescribe you certain non-steroidal anti-inflammatory drugs in order to reduce the level of pain and swelling if this persists. Next is, depending on the level of injury, whether it is just in strain or else it's in tear. Based on that, it is determined whether it requires in physiotherapy management or else in surgical management. Physiotherapy management basically comprises of mobility exercises, flexibility exercises and strengthening exercises, which is sequenced based on the level of injury. But if the tear is more, then mostly surgical management is ideal. After surgical management also, it's very important for the patient to go for a physiotherapy rehabilitation, since this helps a patient to get back to the normal day-to-day activities. Anterior cruciate ligament injury is a common injury seen in athletes. Hence, post-surgery, they need to get back to their sports activity, which requires a very extensive rehab protocol, where there is a constant focus on improving the mobility, flexibility and strength around the knee muscles, and also to improve the agility of the body. Hence, it's very important that physiotherapist and orthopedic surgeon work in collaboration with patient in order to determine a long-term recovery for the patient. So friends, this was a brief information about anterior cruciate ligament injury. I hope you found this information helpful. If yes, make sure to like this video, share it with your friends and family members, and don't forget to subscribe to our channel. I'll come up with another video next time. Until then, bye-bye.